Well, hello and welcome to a session of Your Health with Caldwell UNC Healthcare. I'm Rocky Brooks, joined today by Dr. Robert Duggan and also Dr. Ross Jenkins, and we're going to be talking about your feet and podiatry. So, gentlemen, good to have you in here. Thank you for taking the time from your busy schedules.
Thanks for having us.
Good to see you.
Dr. Duggan, let's get started with you. I want to know a little bit about you, your background,
Sure.
and why healthcare, and in particular, why get into podiatry?
Actually, that's kind of a short but longer story. I started out as an athletic trainer, believe it or not, and part of what I did was worked with a lot of athletes, and I had a friend of mine that was a podiatrist, and he actually gave me a job through high school and college as a podiatry assistant. So I got trained as a podiatry assistant early on, and then I applied to one school and got an opportunity to go to Cleveland for podiatry school, St. Louis for my residency, San Diego sports medicine for 5 years, practiced there, and then I got recruited to Florida and was in Florida for 25 years. And Dr. Jenkins and I worked together at one of the hospitals in Florida, and I used to bring my kids up here to learn to ski, and one thing led to another, and we ended up looking at possibilities of me coming up to help him and to move up to the area, and that's worked out great so far.
And you've been here since when?
6 months now.
Okay, got to know the community quite well.
Yes. A little bit beforehand, I did know a little bit about the mountain area and you know, the difference between the elevation in Caldwell County is amazing. And so I got to see the lower ends, the sea level ends, and then the mountain ends as well. And
Part of the beauty of living here, right, Dr. Jenkins?
Agreed. Fantastic place.
And you've been here for a number of years. I think you and I came pretty much together to Caldwell County.
22 years.
22. I got a couple of years on you, but I have a year or two of age as well. Tell us a little bit about you, your backstory as well.
Mine's a short but long story too, but the basic of mine, podiatry, when I was 15 years old, I was in a car wreck, and I was actually going to be an attorney. My dad's an attorney, and I was going to follow in his footsteps, and I was in a car wreck and hit a tree. I wasn't driving, we weren't doing anything we weren't supposed to be doing except going fast. And we hit a tree going 100 miles an hour, went through the windshield, and broke my shoulder and both my legs. They wanted to amputate my left leg in the emergency room, and then an orthopedist saved my ankle. And he did a great job on my ankle, and then I had 5 surgeries on my foot, and I was begging my father to get my toes cut off because I couldn't get my foot into a shoe. And so my dad said, well, we're going to try a podiatrist, and I said, well, what's that? So he sends me to a podiatrist, and he did office surgery on me and got me back into a shoe, and I was able to play college sports. So that was a life changer for me, and at that point I knew what I was going to do. And I was actually being recruited, not exactly to Lenore, but kind of stumbled into it, and back when Fred Soul was here, and it was amazing when they made me an offer, and I walked to the front of the hospital and looked at it and felt at home, and so that's how I stayed. So.
People that don't know your backstory will take a look at you today and think you're nothing but the epitome of health, but just you've been to the mountaintop, you fell down and got back up again.
Very lucky to be here, so I feel very fortunate. But for me, it was one of those things. I feel very fortunate in my training. Dr. Duggan was part of my training, and I think that I think we're fortunate to be where we are and in the people that we have. And it's not just us; it's the entire community.
Right.
I think. Looking at Caldwell UNC Healthcare as a whole, we have excellent physicians here, and you wouldn't think so to be in a small community. But I think we certainly set a standard of care that a lot of other places can't meet, and I feel very fortunate that Dr. Duggan came, because we have a very similar thought process, and it's all about patient care in the end, and that's what we want as results.
And Rocky, we almost have telepathy. We understand what one is doing, and the other one can kind of help out. And so it's a pretty good partnership for the two of us, because we don't have to wonder what the other one would do in a situation. We're comfortable taking care of each other's patients. It's been a kind of a joy for me, and I just mentioned today to one of my patients, he's probably the only one I would go into practice with at this stage of my career. you know, because you have to trust people, and, you know, at this stage of our careers, we both know what good care is and what substandard care is, and I wouldn't have even shown up here if I didn't think that the hospital and the university system and the community wasn't a place for us. And, you know, I think we have the opportunity to really kind of escalate the level of care just by the two of us being together. It really helps out a lot. For the longest time, Dr. Jenkins wasn't able to take a day off, really. You know, he'd go places and he'd have people cover, but it wasn't him covering his patients in some cases. And now I think we would both feel comfortable, you know, leaving town, knowing the other one's here taking care of the patients.
And that's more than just that professional bond.
Oh gosh, you know, if you don't feel that your patients are part of your family, then you probably need to not take care of patients.
You see an awful lot of different things in your life when it comes to working below the knee. What are some of the common things you may run across? Either one of you care to address?
Probably, I mean, you know, we all know that we see a lot of bunions, a lot of hammer toes as far as deformities are concerned. And the one thing about everything that we do, ingrown toenails as well, but, you know, everything needs to be symptomatic before treatment. And so, you know, people come in with bunion pain or with bunions and don't necessarily have pain, and neither one of us will do surgery on them without discomfort. I mean, that's just you know, you don't do things to people you wouldn't do to your own family, and that's just kind of a common sense approach. But we do, you know, we do everything from ingrown toenails to ankle fractures, ankle replacements now, diabetic limb salvage, and, you know, limb salvage has become a huge part of this practice, and actually I think of the hospital as well. You know, and that's a team approach. It's not just us. It's everybody involved, including nursing, supervisors, and everybody. So, you know, and, you know, the other medical specialties too. So, you know, I think that, you know, with our population that we have up here, we have a very large diabetic population with unmet needs that we're very fortunate to be part of, and hopefully make a difference in their lives.
One of the things that, you know, struck me as a real opportunity, Dr. Jenkins has kind of developed, you know, he has a little bit of a following, you know, with physicians in the area, and really there's patients coming from 3 different states. Here we have 2 podiatrists on staff. At one of the hospitals that I was at most recently in Orlando, we had 163. You know, so this is kind of a magnet for pretty high quality care that you really can't get in other spots of the state. There's not too many people with the backgrounds that we've had and the experiences that we've gone through in our training and in our experience. So it really does kind of lend itself to, you know, Caldwell as being an area that's going to draw from major areas around us and throughout the state for things that just aren't being done other places.
Well, one thing I know has not been done is operating on a gorilla. So I think you have to explain about that, please, Dr. Duggan. Not here, as I understand, but it could happen.
Memorial, but yeah, one of the neat experiences that I've had historically is I did a lot of work for Disney and Animal Kingdom, and I'm a consultant for Animal Kingdom. So whenever they would have one of their exotic animals that had a lower extremity or a foot or a paw problem, in many cases I got called, and they had a silverback gorilla, their alpha gorilla, Kajana, down there, years ago, stepped on a piece of wood and had a puncture wound. You wouldn't think that that was an issue, but they had lost one of their silverbacks with the exact same condition. And their director of veterinary care at that time called me and asked if I would come in and take a look, and we ended up doing 2 procedures, and Kajana is running around down there now and did well. It was broadcast throughout Disney, and it's on a CD of your Animal Kingdom experience. But the penguins at SeaWorld, the flamingos, the gorillas, I have all of those listed as my patients.
Did you ever think that you would even attempt to work on an animal other
No, that was
humans? And this,
yeah,
pretty remarkable.
That was a little scary because that's a pretty smart foot that the gorilla has, you know. And back then I had a fellow, and my fellow did some research on the comparative anatomy. We had to go to University of Florida and Cornell University, and we actually did a poster presentation for the American College of Foot and Ankle Surgeons on puncture wound in a silverback gorilla. So he is the heaviest at 450 pounds patient I've ever treated.
But I wonder, with rehab, how do you put an animal through rehab without doing damage to what you've already done?
Well, you have to just keep your fingers crossed because there's really no way to, you know, to monitor that, to have them, you know, offload the area. It's a pretty scary thing. When I went to examine the gorilla, they gave me a dowel and said, "Don't look him in the eye." And I said, "Okay," and I walked behind the one veterinarian, and he looked at me and he said, "Okay," and all I heard was this breathing behind these large, you know, steel cage, and I looked up and he's this far away from me, and he's staring me right in the eye, and I remembered he said, "Don't look him in the eye," and so I looked at the veterinarian and said, "What am I doing with the girl?" He said, "Probe the wound," and I go, "Oh, no, I don't think so." I said, "It needs to be opened up." So at that point, we knew that we needed to actually do something without him standing watching me.
I'd be looking for an assistant.
Yeah, that's right.
That is incredible.
It was great. It was great. It was an honor and a privilege to take care of those animals because they're really, you know, kind of. It's very similar to taking care of, you know, family members. I mean, you're the only one they have, and they trust you completely as the caretaker. So it was an honor.
And they're such icons. People love animals,
Yeah.
some more than they do people, as it happens to be, but especially in a zoo. And you know how revered animals are, whether it's a koala bear or whatever it may happen to be. But then with a situation like this, I can't imagine anyone trying to tackle that.
Yeah.
That's just amazing.
It was really a lot of fun.
What about you? Not gorillas, but some interesting circumstances you've run across in your years of work.
Oh, put me on the spot to think about one in particular. You know, and I don't really know right off the top of my head of anything in particular that's amazing. You know, we did. I guess in my line of work, what I really enjoy is the difficult things. I enjoy tackling things that other people don't like to tackle. Because, you know, such a difference was made in my life, you know, I want to make that difference for other people. And one of we've had many patients in the wound center that were there for amputations, and they wanted a second opinion, and they walk out months later, and they walk out of there, and then, you know, in essence, we saved their life. Because, you know, there's good research out there that shows, you know, that the 5-year survival rate with amputation is very low. And you can, you know, you see when they cry and thank you, that there's nothing better than that. And, you know, you watch them walk out, and to me, it makes everything we did worth it.
Now think about what you did with this gorilla, and I think about his backstory and what he went through with that accident. Just on the outside, hearing his story, would you say that whoever performed the procedures on him did a very, was that in your mind, just on your top of your head?
They could have
How
buffed up
challenging.
his attitude a little bit, but I think they did a great job with the ankle.
You know him quite
Dr.
well.
Jenkins and I have been friends a long time. And one of the things that has kind of struck me is, you know, really kind of the student has become the teacher. And in some of the things that Dr. Jenkins does now, it's not routinely done anywhere. And so some of the routine things that he and I are now doing together are not routine other places. And I think that's kind of what's been instilled in his training. And hopefully we had a small part of that down with our group down in Florida. But I think he's kind of brought that, you know, kind of full circle. You know, to see a challenge like that and a life-changing event and to be able to actually extend that to your patients is kind of unique. I think we all try and do our very best job as physicians, no matter what specialty, but to have personal experience of what we're doing daily is not typical. And for him to be able to do that, that's one of the reasons I'm here.
And we're glad you are. Once again, we're talking with Dr. Robert Duggan and also Dr. Ross Jenkins, podiatrist here, Caldwell UNC Healthcare, talking about your health and these folks are always accepting patients. Is that safe to say?
Yes.
Oh,
Of course, you
absolutely.
may have to wait till your birthday to get to see one of them. However,
Yes.
they are accepting patients. We're glad to hear that. I want you to talk a little bit, Dr. Duggan, about your background as well with athletes and treating
Sure.
athletes.
Yeah, as I said, I started life as an athletic trainer, and I did have about 3 years where I was a quasi-professional downhill skier and did a lot of athletics growing up. The interesting thing was that my sports medicine background kind of followed me. So I was able to teach sports medicine at Washington University while I was doing my residency in St. Louis, and then joined San Diego Sports Medicine. We took care of the Otay Mesa Olympic Training Center, the Chargers, San Diego State, USA Volleyball. And I maintained a lot of those relationships all the way through till even today. Work with USA Gymnastics, historically with USA Decathlon, still with USA Volleyball quite a bit. Recently I've been able to help out with the athletes up at Appalachian State, which has been a lot of
Thank you
fun.
for that.
And their athletic training program is spectacular. The care that the App State kids get with athletic trainers up there is top quality. They have a tremendous program, and they also have an educational program. And I've been lucky enough to teach historically both in medical school in Orlando and with the athletic training program. So I've kind of kept that athletic medicine point of view with all our patients, because we really don't know when our patients are going to be athletes. You know, we have 70-year-old patients come in and say, I'm going to run a race. And I always kind of wonder, you know, how far are you going, when are you going to do this, and somebody going to be around? But we kind of treat all our patients that way because we're aggressive with the things we do surgically, we're aggressive with our rehab, we're cautious with our return to activity so that they optimize their efforts. And you know, you want them to, we want to set our patients up for success, just like our athletes. So that perspective, I think, is kind of carried along with me. Dr. Jenkins has been an athlete for a long time, and has that experience as well. So we really do have a lot of similar mindsets with our approach to athletes and patients.
Do you, either one of you ever feel the pressure that you're dealing with an athlete? It could be a scholarship they're going after, maybe their own scholarship if it's a college athlete, a professional athlete, what could become of them? Does that ever weigh into your mind, or do you just go ahead and set that aside? And
I think you think about it initially, but the fact of the matter is, I treat regular patients, non-athletic patients, the same as athletic patients. So I don't think it changes our course of care at all. You know, with especially in the kids, you know, that we get locally that come in from games or so forth, I'm more concerned about the longevity of function versus, you know, getting them back to the game as quickly as possible. Because, you know, I mean, we all know this is a whole different subject, but, you know, most of these kids won't go on to professional athletes. And, you know, so it's more important for them to be able to function in life than to become, you know, to stay with the athletic field. But again, I mean, you know, the fact is that we don't change the way we don't change our approach to patients based on what they do or age or anything else.
I think you have an appreciation. I think we both understand the importance of athletics.
Mm.
I have two Division I scholarship swimmers. Both my kids are athletes, and you know, we want to make sure that we approach them just like they were our kids too. So you're always, you know, my dad was an electrician. He said there's two ways of doing everything, the right way and every other way. And so you try and approach your kids just like that, whether they're athletes or not. I've treated a lot of professional athletes, and you know, sometimes it's the expectations that don't match. When the treating physicians or the therapists or the trainers and the athlete, when their expectations don't match, that can be an issue. So with all our patients, you try, just like an athlete, to say, here's what our expectations are, what are yours, and we try and get them to kind of go down the same path.
A bit psychologist at the same time, as well as podiatrist, and possibly a cheerleader for them as well.
All the above.
All right, Dr. Jenkins, I want to ask you, if you will, because you mentioned coming in complete ankle repair, and I can't fathom it. Explain.
Degenerative arthritis is tough on lots of people, and you know, we've been doing total hips and total knees, or not us, orthopedists have been total hips and total knees and shoulders for a long time. We do total great toe implants for some arthritic deformities. Kind of, total ankles have been, the evolution has been very slow. It's probably been around for about 20 years. The ankle joint's very complex. A lot of the ankle implants that were been out for years had a lot of joint destruction, so there really wasn't a good salvage, and so I kind of strayed from them. But the more recent designs of the ankle implants now that we can do, you know, it's select patients, but we can actually replace the ankle joint. And then if it were to go bad, then we can, you know, we can salvage it. And then so, meaning that we could go back and fuse the ankle if we had to, or, you know, make one bone out of, you know, the foot of the ankle to give them something functional to walk on. But the fact is, if we can maintain mobility and maintain function, then it's a better quality of life. And so, you know, I think implants, as you know, with total knee replacements and so forth, are very important for people to maintain quality of life. And then now that we are the only, to my knowledge, the only group in the entire region that's doing total ankle replacements. So, you know, now if somebody has post-traumatic arthritis from a car accident or from any type of injury that suffered a broken ankle and develop arthritis that's limiting their mobility, we have other options available besides fusion. Both of us are joint sparing surgeons, and so I think fusion, part of my foot is fused, and I don't really care for it too much. And so, you know, I take extra caution if I can do other things to save mobility. Because, you know, sometimes it can be as simple as bending down to pick up a piece of paper off the ground and you don't have mobility in your ankle joint. You can't do it, and you have to alter your gait, which ends up with back problems and knee problems and hip problems. So I feel very honored by some of the companies that are allowing us they approached us about doing some of the replacements. And so we trained, and we've done a few now, so I think that it's excited about that, new opportunity.
So the technology, the skill may have been there, you study, you know what to do, but the technology has come along so that there's a quality of life afterward for a long period of time?
Yeah, I think one of the important things is that, you know, there has been an evolution of the joint replacement technology itself. And to be able to say at some point in the development of that, this is a reasonable thing to offer my patients. And that's something we have to assess in everything we offer our patients, whether it's an injection, a therapy, a brace, anything. And when you finally get to the point where the technology now is a reasonable approach to the conditions, and there's some narrow indications for every procedure. We're starting to see now a match between some of our patients and the technology, which is great, and it's worked out very well so far. And I'm old enough now that I've seen the evolution of this, and now it's at the point where I would say it's a reasonable opportunity for our patients in some cases to offer the total joint replacement.
I've got some notes here, and it talks about your approach, and perhaps yours as well, with the elderly. Some people may just say, hey, this is the life I've been given, they're 65, 75, whatever, and just leave it at that.
How old, Rocky?
I was talking about Dr. Jenkins.
Okay.
So I aspire to be his age again. But for the elderly, how do you approach situations with them? How about some words of encouragement, if there are any, for folks who are suffering at this age?
Sure. Do you want me to handle the elderly question? You know what, I think that's a really good question. You know, like I said, we never know when our patients are going to be athletes, so we do have the same approach. You know, I've run 2 marathons. I'm working up to the 3rd, maybe. You know, so I think the encouragement is we need to keep our patients regardless of age, we need to keep them as active as possible for as long as possible, because that does 2 things. It keeps them engaged and contributing to their family and themselves and to the community, but it also decreases the cost to everyone else. You know, if our patients are productive, they're productive. They have less need and less less wants from the people around them.
Right.
They're actually giving to the people around them rather than receiving. So one of our goals is to keep them active, healthy, and mobile for as long as possible. One of the things that we see falls in the elderly, in many cases it's because of loss of motion in the big toe, in the ankle. You know,
Okay.
so we're seeing things every day that affect the outcome of some of our older patients. And so some of the things we do day in and day out is a very common stretching program. Well, it's proven to decrease falls in the elderly, so we get to do a lot of things with some very easy, things we do day in, day out that help our patients.
Not everything's surgical.
No, I mean, but education is key too. And I think if you can talk to patients, whether elderly or young, and speak to them and try to put things in a manner they understand, and then it makes them part of the team. And that's with everything we do. And it's every patient. It's not just one specific.
Okay, I know we're getting close to the end of our time, but I want to leave just a couple moments for each of you to address the folks who are watching, and we're talking about podiatry care. And what would you like to tell the folks in this area who come see you as patients or maybe?
Well, I think that the one thing I think both of us have mentioned already is I learned a long time ago, don't do things to people you wouldn't do to your own family, and always do what's right. And I think that that's what you're going to find in this particular practice. Everything we do is designed around you, the patient. And I think my grandfather told me a long time ago, if you're not going to give it 100%, don't do it. And I think you'll always find that with us. I think the Caldwell UNC Healthcare Home has been, it's been a home back for me, and I think they have been pushing for exemplary care, and I think that you'll continue to find that with this practice as time moves forward. We are doing a lot better now as far as getting timely appointments. We now have 24-hour call, and I think we will certainly be happy to help you with any problems that you may have or have questions about.
I'm pleased to be in the community. It's a pleasure to join Dr. Jenkins and Caldwell Memorial. Dr. Jenkins has heard this before, but we were told once by a professor at the school we both went to that treat your patients like family and your family like patients, because all too often neither one happens. And I think that's really kind of the motto that we would kind of carry forward. We're available to help, and the hospital's done a great job of continuing to increase the care to the community. And I think that if you came in to see us, I think you'd appreciate that as well. So, thanks, Rocky.
Yeah, thank you both. Folks, you've learned a lot about their expertise. As a coworker way off to the side, I can tell you these are two of the nicest people you would ever run into in the hallway as well. They speak to everyone, and I think they appreciate everyone, and it shows. We thank you for your time. It's been a pleasure to learn about both of you and what you do. So keep in mind, all right? And thank you again for joining us, talking about your health and Caldwell UNC Healthcare. Have a great day.